have with us Mr. Preetham Singh Mogi today. Now, when Sir came to me, the issue was that he had shortening of the limb and he had a fracture when he was in his 20s, and there was a very bad deformity in the left leg. So he had been to a few centers, and the issue was that everybody told him that this surgery is not going to be easy. They'll have to cut the bone, they'll have to put rods. So what I have done with him is called a computer navigated knee replacement, where when we do the knee replacement, we actually bypass the deformity and we align the knee with the hip. So how was the experience?
Sir, I am very happy with the knee surgery, this total knee replacement. More than that, I am very happy because this deformity has been reduced, which I was carrying for the last 40 years. So my leg is little straight now. So it will be more straight after my exercise and bending. So far I can bend up to 70 degrees. Hopefully I will go to 100 degrees.
You will be able to go to about 120.
And my walk is now very easy and comfortable. Previously it was paining always. Regularly paining, even in young time. But now I am more comfortable. And my limping has come down. That is what
Today's how many days post-operative?
it's 18 days.
18 days, okay.
So all this recovery has happened in the last 18 days.
Perfect. And my physio is also good. He is making me do a lot of exercise under your guidance. And I will continue.
Can you stand straight and just show everybody how?
Yes, see, previously it was like a bow and arrow. Like a bow, it was turned like this.
Okay.
Now it's almost getting straight. That is one of the best things I've got.
Okay.
It was like arc,
Okay.
small arc, but now it is better. And because of that, I can walk without almost minimum limping. So that is there. And plus, walking is more comfortable.
So overall, sir, you are happy? You think you made a wise decision?
Perfectly, 100 of them. And I will suggest my age friend of 60s, 70s to go for Dr. Garak.
Wonderful, sir.
Perfect. And the services also, timely consultation was given at home by phone, and he always bothered that how I am doing at home.
Yeah.
So that is something great.
Sure, sir. Good to see you back in life and good to see you back.
Thank you.
You're welcome.
So I will be doing a video soon, and I'll be telling you all about what computer navigated surgery is all about.
Yes, yes.
What we do with this, and what are the advantages of this surgery over the conventional knee replacement. So we'll take that up in the next video very soon.
Thank you, doctor.
Thank you.
For more information, contact Dr. Khera's Wellness Clinic.